All right, welcome everybody. Can everybody see and hear me now? If you can't, just type something in the chat box. Otherwise, I'm just going to assume that everything is functioning properly this time. Hello, I'm so happy to see all of you guys here. What a fun little event we're having. I'm so happy. All right, sounds like people can hear. If you have any issues, just let us know. Good morning. What a beautiful morning. Happy December. We are super excited to be doing our webinar today on the PDO thread lift, or what we're calling modern facelifting. We've had a ton of interest on this in the last few months. Actually, I don't know if this is kind of a nationwide thing or what's going on, but people are super excited about thread lift and what it can do. So I'm very excited to talk to you guys today about the company that I'm working with and why I really am loving the thread lifts. So we're going to go ahead and get started. I'll pull up my PowerPoint presentation. Just want you all to know that Mickey made this presentation. It's beautiful. If you have any questions, I'll probably answer them at the end, but you can go ahead and type them in, and I'll make sure that I have time at the end to answer all of your questions. But there's a lot of information in this PowerPoint, so it may answer most of what you're wanting to know anyway. So welcome to Modern Facelifting Techniques, and I named it this because there are so many patients, mostly women, that are looking for an alternative to facelifting, surgical facelifting, that we can offer in the office. So this is a really exciting way to kind of give patients an alternative to a surgical facelift. Most of you I have met. I don't think I recognize not recognize anybody, but I'm Dr. Kim Harris, the owner of Prescott Medical Aesthetics. And we've been open now for about 3 years, and we focus mainly on aesthetic medicine and hormones, although we are soon to be expanding our list of services, hopefully hiring on a new doctor. So we're going to be offering more naturopathic, family care, women's medicine, and hopefully other services on down the road. All right, let's dive right into what you all want to know. So I just wanted to talk about a little bit about what causes aging. Obviously, you know, there's a lot of factors that go into it, but the biggest causes that we see that cause aging in the skin, number one is smoking. I think everybody is pretty aware that smoking is harmful, you know, not just to your health, but also to your skin. So when we have smokers, we see a lot of deeper lines, a lot of congestion in the skin, and it's really difficult to treat those patients. Second, and everybody's pretty familiar with this, is sun exposure. We also have genetic factors. Many times a day, I have patients come in, they're like, I have my lines right here. That's from my dad, or that's from my mom or my grandma. So genetics obviously play a large role in the way that we age. Sleep habits, we'll talk a little bit more about what that means on the next slide, you know, as far as getting enough sleep, but also the way that we sleep. And then obviously the way that we eat makes a big difference. You know, oxidation is a big cause of aging in the skin. So when we eat, we want to make sure that we're eating antioxidants. We'll talk a little bit more about that as well. And then alcohol and caffeine, I would say those are probably further down on the list. The big offenders, obviously smoking, sun exposure, and then genetics, which that we can't do a whole lot about. All right, so what kinds of things can we do to prevent or reverse the signs of aging? Number one, if you're a smoker, please try and quit. I know it's hard, but not only does it affect our skin, but obviously health. The next thing is just to drink plenty of water. Our skin gets really dehydrated, and yeah, you can certainly see that, especially under the eyes is a big area where you can see dehydration, but you also, don't get that nice kind of shiny, bright look if you're dehydrated. So make sure you're drinking about half your body weight in ounces per day of water. Diet is a big factor in aging. So it certainly shows up in our skin when we're not eating well. And then obviously eating lots of antioxidants. So, reducing the amount of red meat, dairy, sugar that we eat, and then increasing the amount of antioxidants we eat in the form of vegetables and fruits, especially like darker skinned berries. Make sure you're getting plenty of exercise. You do need to protect your skin with high quality products. And if you've met Elaine, you know that we all love the Epion's line. Not only do they provide some antioxidants, they are anti-inflammatory. And then most importantly, we have our 50 SPF on a daily basis. It makes me laugh when patients are like, well, I don't go outside. Well, you do. You walk to your car, you walk to the store, and then also, you do get some sun exposure just from driving. The left side is typically worse for patients, and that has a lot to do with the way that they sleep and then the sun exposure from driving. So make sure that you are wearing your sunscreen all day, every day. When we talk about sleep habits and how it affects the way that we age, one, make sure you're getting enough sleep. Obviously, sleep is very restorative and regenerative. And the other thing is just make sure that you're sleeping on your back as much as possible. A lot of times when, I don't know if you guys can kind of see me down in the corner, but when women have those really deep lines here, they have deep lines around the crow's feet, or they have vertical lines across the forehead. Those are actually caused by the way that we sleep. So if you're a side sleeper, it's going to be harder to treat the wrinkles and lines that you have until you start sleeping on your back. The other option is to use the silk pillowcase, which isn't as good, but if you can't sleep on your back, which I have a really hard time doing that, then you can use the silk pillowcase. And then also limit alcohol and caffeine intake. Those tend to dehydrate us and affect the way that our skin looks. So, we have a wide variety of things to use for anti-aging. Obviously, I do a lot of Botox and Dysport on patients. There's certainly a place for that, mostly for the upper half of the face, third to half of the face. Fillers are great for restoring volume, and really the theory used to be if you replace enough volume in the face, you can get rid of wrinkles. And that's really how you get those patients that just look totally overfilled. Their cheeks are filled out so much that they don't have wrinkles, but then they also don't look like themselves anymore. So filler and Botox and Dysport can be used very strategically in combination with other therapies that we're going to be talking about. So that's why it's important to get a good consult and see, what's going on with your face, what are your signs of aging, and what's the best combination treatment for you. So when patients come in and they have these signs of aging, especially in the mid-face, it's caused by loss of collagen and sagging. We have jowling, we have deep nasolabial folds. And what they need is not more filler, but they need some lift. And I constantly have patients come in, they pull their face back. They're like, oh, if my jawline could only be pulled back like that, if my face could only be pulled back like that. Filler does not lift like that. And if it does, you're going to be overfilled. So this is the PDO Thread Lift by Mint is a great alternative to just overfilling and kind of making you look puffier. And so we can use fillers in combo with these threads to kind of provide some lift. And that's exactly what most patients are going to need. So I've been doing PDO threads, and PDO stands for polydioxanone. So I've been doing polydioxanone threads for about 3 years now. And I've used 3 different companies. Mint is my third company that I've started working with. And the the way that they make their threads and their training and their procedures are really different from other thread companies, which is why I've been so excited about this new type of thread that we've been using. I'm seeing better results. Patients that have had one or two of my previous companies, they notice the difference as far as lift goes. So we're going to talk a little bit about what makes this different and what we can do with these threads. So PDO threads in general tend to be really strong. They're hypoallergenic, and the way that we know that is because polydioxanone is actually what internal sutures are made out of. So if you go and you have abdominal surgery and you need, something inside sutured up, they use that same type of material and it just dissolves on its own. So we know that patients don't tend to react to these products. They're very safe and well tolerated, and they're long lasting. Threads typically last about 6 months in patients, although I have felt them longer in some patients. So they're not completely dissolved by the 6-month mark. MINT PDO, so MINT stands for minimally invasive non-surgical thread. These are a very safe type of thread. They're stronger. They do have an FDA clearance. They're not FDA approved, and not many threads are because of the long approval process. But these threads have been used worldwide for many years, and so we do have a lot of safety information on them. Let's talk a little bit about the different kinds of threads that are out there, because there is some confusion about this. So typically when we're talking about a thread lift, we're talking about larger barbed threads, which sounds scary. Patients kind of freak out about the word barbed, but the barbs are really pretty small. You can see them, but not really well, and you cannot feel them underneath the skin. And what the barbs allow us to do is to actually attach in the dermis of the skin, and that's what allows me to pull. The nice thing about any of these threads is that you do get new collagen stimulation around them. So they've done cross sections in animal studies when they place these threads, and what they're actually seeing right around those threads is collagen stimulation. So really anything you put under the surface of the skin, you're going to see some collagen stimulation. So we see the large barbed threads are for lift, and those can be put anywhere in the mid, lower face. They can be put in the neck or along the jawline. We also have some screw or twist threads, and those have a little more volume to them. So those are actually really good for kind of filling in deeper lines. They actually replace volume kind of like a filler would do. So those threads are mostly used for the glabella and between the brows, and they're really great for kind of the deeper sleep lines that we see. And then we also have smooth threads, and those are purely for collagen stimulation. So with the screw and the smooth threads, you don't really see a whole lot of difference the first 4 weeks of treatment, because collagen production takes about 4 weeks to run through its cycle. So we see best results with the screw and the smooth threads at about 4 weeks. And then with the barbed lift threads, we see immediate results that get better over time. And that's what patients really love about this procedure, is that you see great results right away with the larger threads, and then you continue to get better results over time with that collagen stimulation. And that's what really helps these threads to last longer. So I was talking about how the threads last about 4 to 6 months under the skin, but because you have collagen stimulation, that collagen is going to last way longer than the threads themselves. So results last 9 to 12 months on average for most patients. Now that does depend on you. Are you doing everything you need to do to make sure that you're not losing more collagen, sunscreen, protection, drinking plenty of water, all of that good stuff that we talked about at the beginning. So I wanted to just talk a little bit about what makes these threads better than other threads that I've used before. So the biggest difference with MINT is that the threads are actually molded and they're not cut. So So you can see on the lower picture down there that they'll have a thread that's cut in, and that creates barbs. And the problem with that is that they're much weaker. So the barbs dissolve more quickly. You can see the progression over time there. And then they just don't like stick in the skin as well, because it kind of creates a little bit of instability in the thread itself. So the molded threads, you have the full thread plus a barb on top of it, and it just makes for a much stronger thread that gives me a lot more lifting power. Barb direction also makes a big difference. So these are called multi-directional, and so you have barbs facing every which way, up and down the thread, depending on what kind of thread type we're using. So that also allows me to get a little bit more lift, and they hold in place better. But I think probably what made me most excited about these threads is the technique. I told my husband when I went to the training, I was like, he asked me what I hope to learn from it. And I was like, nothing. I've already done thread training twice. I've been doing this for a few years. I just need to get trained so I can use these threads. And it was the best training I have done for threads. It was amazing. So the technique is better. I learned some new tips and tricks to have better outcomes. And I also learned how to do a brow lift. So I've been doing that on a few patients with really great results, because as many of you know, it's really hard to get brow lift once you start kind of having some hooding in your eyebrows. All right, so this just kind of gives you an idea of what the threads look like. They are blue. You don't see them under the skin, but you can see that there's kind of thick barbs that go every direction all the way through the thread. Now, there are different threads that have different directions up and down the threads that are used for different areas. So that's where, you know, kind of knowing the product line comes in handy. But most of the threads are this barbed type. All right, just a little bit about the procedure itself. It is pretty quick and easy. So I would say, depending on how many areas we're doing, it can take from 45 minutes to an hour. I do use lidocaine to numb, and so it's pretty tolerable. Depends on the patient, obviously, and what area we're working on. Kind of the lower face tends to be more tender during treatment, and then the neck is usually the least painful. Really, we see minimal downtime with this procedure. The biggest issue that patients have is a little bit of bruising, typically from the lidocaine where it's injected, but there's no incision, very low risk of any kind of infection. You don't have to be on antibiotics afterwards. And if you're wearing a mask, this is the ideal time. Honestly, probably nobody's even going to know that you had anything done. Like I talked about, last 9 to 12 months. And we can do all different kinds of configurations in the face. So we can work on kind of lifting the nasolabial folds in the mid-face. We can get rid of marionette lines and jowling. You'll see in some of the before and after photos that you can really redefine a jawline. And then the neck lift is great too. That's one of my most popular procedures, because really for neck, there's not a whole lot besides surgery or doing a thread lift. Patients tend to be very, very satisfied with this procedure. All right, let's look at a couple of before and afters. So you can see the woman on the top has had some nasolabial work done. They helped with the jowling, and then also in her neck, you can see that pulled up quite a bit. The woman on the bottom, I'm so impressed with her, like the shape of her face changed. She, you know, was really heavier down along the jawline, and they were able to get quite a bit of lift up to slim down the lower face and add even volume in the upper face. So you could see in this type of patient where a combo therapy would be great. You know, she probably could use some cheek filler along with some thread lift, and that works really well because, you know, we do lose volume, especially along the cheeks. Yep, so the upper upper woman, you can see they really were working on her, like the marionette lines, you know, getting rid of some of that jowling, and she basically has no nasolabial folds anymore. And in the lower picture, you can see it's kind of the same areas. They were working on nasolabial folds and marionette lines down around the mouth, which is probably the most common complaint. This gives you a little bit of an idea of where this woman was treated. She got great results. If you look at her jawline, you can see that that completely smoothed out. And then this is where they placed the threads. So when they talk about vectors, you're just trying to figure out and visualize where in the face you want to place those threads to get the most impact on the area that you're trying to work on. So she really got a lot of benefit right around the mouth, and obviously they did some neck work for her that smoothed that out as well. This lady, man, look at that jawline. The corners of her mouth were turned up, and then it looks like they also did some of her nasolabial folds as well. This lady looks 10 years younger. So you can see again how they were able to slim down the lower area of her face. And I don't think she had any filler in this, but it looks like she did because her mid face is more volumized and the lower face is slimmer, which is exactly what we're going for in facial aesthetics. You know, we're trying to get the mid face to be more volumized and the low face to be a little bit slimmer. That's the hallmark of a youthful look. All right, jawline on this lady, super common area for women to have trouble is that little jowl that just comes in. So she had, you know, you can see in her neck, she got a lot of benefits, and then also along the jawline and for some jowling. So I think those are some pretty amazing before and after photos. I did want to leave some time for some questions. Does anybody have any questions for me? We'll just leave it on for a few minutes so we make sure we get everybody. All right, we got a question. When can you return to work? Like I said before, the downtime is really quite minimal with it. So you can, you know, the bruising is minimal. You can usually cover that up with makeup, and then you're going to have swelling for about 48 hours. So a lot of patients will just do it like on a Thursday or a Friday, and then they should be good to return to work by Monday. Obviously, you always have the possibility of more severe bruising, but you know, as long as you ice and, you know, stop any blood thinners beforehand, then that's pretty minimal. Recovery time on it really varies from patient to patient and where you're having the threads placed. So typically when we're doing threads along the jawline, that's where patients tend to have more pain. So you can have, like, if there's some stretching when you have a thread along the jawline, anytime you open your mouth, you might have a little bit more pain. So yeah, recovery time, I'd say a week for most people, and then maybe some lingering pain for a couple of weeks after that. But it's really when you open your mouth or turn your head strongly until those threads settle in. All right, next question. How many treatments? So typically one with a touch-up. So you come in and we do what I call a full lift per area, and that's 1,200. So like kind of for mid-face, lower face, or neck. And then we usually have patients come back in about 4 weeks for just a touch-up. So we may or may not need to put 1 or 2 more threads in. Everybody's face is asymmetrical, so sometimes we'll have just a little bit more treatment needed on one side. So I would say 1 to 2 treatments, and it's 1 full treatment plus 1 what I call a touch-up that's usually quite quick. Marlene asked, were these group procedures? And I don't know what that means. If you can clarify, Marlene. There's not a limit on how many lifts you can get. I do have patients that'll come in every few months and just get like 1 or 2 threads to just really keep it tight. So I'm sure there is a limit on how many threads you can get, but it would be hundreds, I would guess. Somebody asked, are there lifting limitations? So yes, this is not going to look like a surgical lift. It's not going to completely correct everything for most patients, but we do see, I'd say, a 50 to 70% benefit. So what you can do is lean back or lay back and look in the mirror. That's typically the kind of lifting that we can expect from a thread lift procedure. So it's not 100%. You're not going to look like you did 20 years ago, but certainly you will see a lot of benefit. All right. Is there pain or discomfort? I would say both. So usually you'll have a lot of pressure in here, and then sometimes when we get a little bit closer to the mouth, there is some pain, but patients that have had it are happy to come back again for it. It's definitely worth, any pain or discomfort that there is. And afterwards, you can take some Tylenol and ice everything as much as you want. As far as cost goes, we're looking at $1,200 per area. I think I mentioned that before. And so, if we're really focusing kind of on the mid face, on the lower face and jawline, or jawline and neck, that would be $1,200 for each area. Although if you're wanting more areas, we can price out kind of some extra threads in each area. It lasts 9 to 12 months for most patients. And that being said, by 12 months, the threads are gone and you will have to be retreated at that time. So a lot of patients will come back every 9 months and do touch-ups. So maybe not the full lift, but we put in, just a few threads here and there just to kind of touch up. All right. Somebody asked if it helps with lip lines. It can. So those would be the collagen stimulating threads. I actually see better results with resurfacing like microneedling and filler for lip lines. So the Secret RF is great for that. And then just a little bit of filler to kind of smooth out those lines. If you don't want to do filler, we can do smooth threads to smooth out lip lines, but it takes a long time to see benefit. And honestly, I just see better results with filler. Let's see. Somebody asked, have the threads ever broken? So when I first got trained, they told me that if you do heavy exercise with a lot of downward force, that the threads can break. But I don't see that happening. When I'm putting them in, I'm actually pulling quite hard on them. And these have never broken. From my other company, MetaThread, I did have a couple of break. I think it was a problem with a lot. I think what happens is not breakage, but migration. So that's why you have to be really careful about not doing heavy exercise for a week afterwards that has downward force. So like no jumping, no heavy mountain biking. That's pretty much it. Like just nothing that's going to cause your face to go down strongly. I don't know how else to word it. And that can cause some migration of those threads down. I have seen that, but all of these, any side effects that you have, if there's migration, is all temporary. Your skin really creates collagen over that area and smooths it out. Let's see. Cost. So the best way to get an idea of cost is to come in for a consultation. All I can say generally is that it's $1,200 per area, but that includes both sides. So if you're wanting nasal labial folds done, it's $1,200 for the whole thing, both sides. $1,200 for the lower face, $1,200 for the neck. And then touch-ups are a per thread price. It's $150 per thread. Although, it just kind of depends on what you need. As far as eyebrow lifts go, those are $500 just for an eyebrow lift. Okay. But yeah, we do offer free consultations. So you can call Mickey if you want to get in. We do have a couple of specials for today that I just wanted to go over quickly. So we are promoting our membership. We have a VIP membership available now. We have 3 tiers of that, and that's information is available on our website. So if you sign up for any level of membership, you're going to save 50% off of a full lift. So that'll save you $600. The other offer that we're doing is to buy one area, like a full lift, and then get a small area for free. So that can save you $500 if you do like a mid-face, a lower face, or a neck lift. You can get brows, glabella, or crow's feet done for free. And so those are our 2 offers. So those are good through the end of December. We're really trying to promote this procedure because patients really love it. Claudia asked, is there a long wait for appointment times? There's not right now. I think within the next week we can get patients in, although December is our busiest time. So if you want to get in before Christmas, obviously you want to make sure you have 2 weeks of time in between any procedures and any events that you have, just in case there is bruising. And then, but we are getting booked up pretty quickly. So if you want to get scheduled for a consultation or just go ahead and schedule for the lift itself while we're having some of our specials, give the office a call. I'll put the phone number up top. All right. Does anybody else have any other questions? I can hang on for a few more minutes. I really appreciate everybody coming. I know that this is kind of a fun topic. It's new and patients have a lot of questions about it. So yeah, we hope that you guys love it as much as we do. We're trying to post more videos and all of that kind of stuff. So keep an eye on our social media. All right. Wonderful. Well, if you don't have any other questions, you can sign off. I'll hang out for a few more minutes and then, it's Claudia asked about the membership. It's, let's see if I can screen share here for you. Our website is prescottbotox.com. I'll pull it up here. All right, so here's our website. If you go to membership is here, has our 3 levels, Radiant Rewards memberships, information about all of that. And then our services tab, if you go here, you can read a little bit more about our thread lifts. It talks about specifically about Mint PDO threads, the procedure, and you can book your appointment online or you can call the office. All right. Wonderful. Susan asked the name of our company. We're Prescott Medical Aesthetics and we're in Prescott, Arizona. Awesome. Thank you all for attending. I look forward to seeing you in office. So Becky asked if there's a YouTube link. I think you're having some trouble connecting. I'm really sorry about that. So you should get an email with the replay soon. Hopefully, I don't know how soon they send that out. So you can rewatch it and then Mickey will get it posted at some point, I would guess today or tomorrow. So you certainly can rewatch it. We do have a YouTube channel, Prescott Medical Aesthetics, and we have some of our past webinars on there. We have some procedure information. So yeah, that's a good resource as well. Any other questions before we go, ladies? Very fun. All right, well, I'm going to sign off. You can always give the office a call, 928-277-7414. Come in for a free consultation. Check out our website. Check out our membership programs. That definitely saves patients quite a bit of money, especially with the thread lift procedure. And you guys have a good rest of your day. Thank you so much for joining us. We are going to be doing webinars every month. Those are on our Facebook page already, so we'll make sure we get all that information out. But we do have our webinars scheduled for 2021 already. We've got a bunch of new topics that we're going to be discussing, everything from hormone replacement therapy to the secret RF. We're going to do another webinar about that. So there's a lot of information coming up, and the webinars are always available for viewing afterwards. If you register, you should get that email with the replay information so you can watch it anytime. All right, ladies, I'm going to sign off. Thank you so much for joining us. Have a great day.